This portion of New Day Northwest is sponsored by Bellevue Plastic Surgeons.
Welcome back. It's what everybody sees, your face. So how do you look on first glance? Some people say they look tired or sad when they don't really feel that way, and they want to change their appearance. Dr. George Marosan from Bellevue Plastic Surgeons is here to tell us how different types of facial rejuvenation can produce great results. Welcome back. How are you?
Thank you.
So we're going to talk about the different things that you can do, starting with things that are just, minimally invasive, not that big of a deal either in cost or downtime. So let's take a look at some of the before and afters. You must enjoy your job. It must make people so happy. I'd be happy to see these results. So what are we looking at here?
This is a young lady who came in, and on your left-hand side, you see the photos. I asked her to animate the face, to frown and raise the eyebrows, and so she really didn't like those deep lines. Sometimes we call those the 11s. And we did some Botox on her, and there she's trying to frown as hard as she can and raising her eyebrow.
She can't frown.
She
Nobody even knows when she's unhappy.
So she can still move the eyebrows, but doesn't go up as high, obviously, because of the Botox. But it really takes off a few years off her face. And
so the idea is just to soften a bit,
just
right?
Just to soften things, exactly. Not to paralyze it completely and not move anything.
Because that looks kind of weird.
It is. Because you can't animate the face, and we look at other people and we want to see their emotions, and if you can't see the emotions, it's not very good.
So just soften it a bit. All right, so a different age group person.
This is an older lady who just wanted a little bit of improvement around her lips and mouth, these deep lines she has on both sides of the corners of her mouth. Yeah, and this is, I do this in the office, takes about 10-15 minutes, inject some filler, like Juvederm usually, and it softens it, so if she wants to go out at night, she can't, because this is instant.
So there's no real downtime?
No downtime with this. With the Botox, there's 2 to 4 days before you begin to see the effect of the Botox. So, if you have something, I want to look good for tonight, Botox is not the answer, because it will not give you it takes about 4 days to get the
But
results.
the filler's right now.
But the filler is instant,
And that does look better. It's not completely different, but she just looks better.
Yeah, exactly. So.
Okay, let's see our next shot.
And this is a lady who is from the southern hemisphere and spent a lot of time in the sun, and obviously developed this blotchiness of the face. And I did a skin peel on her called the blue peel, which is a TCA or trichloroacidic acid peel. Kind of partially peels this pigment away, and she's much better. That's after the peel. Again, it's not 100%. Some people who have this pigment that's so deep in the skin might require another peel, probably about 2-3 months down the road, to really get them light.
And what's the time difference between the before and after here?
That's about 2 months.
2 months. So is there redness and downtime with the
about
peel?
A week.
Okay.
Because you have to peel, and that takes about a week, and then you really have to protect your skin with sunscreen
because it's brand new skin when it's
right.
revealed.
You don't want to end up back to that point because you paid money for that, so you don't want to go back.
You do not want to ruin that. Okay, let's take a look at our next set of pictures. And this is a carbon dioxide laser, correct, around the mouth for deep wrinkles?
A little more invasive, and many women, they have these lines, and this lady is not a smoker. We call it smokers' lines, but it happens in non-smokers as well. And so she had other things done too, but this part was with the CO2 laser to peel the skin, and that's her about 3 months out.
That's amazing.
Those lines are gone.
That's amazing. Now, how bad is it right after you've been lasered?
Well, you get like a partial burn, so you're red, and it takes about a week for that to heal. You're still kind of pink, but at that point you can put camouflage makeup on to mask, the redness.
That is
and the
awesome,
redness fades
the result.
out in about 6 weeks.
Okay. All right, let's talk about some of the surgical options. We have a picture of a patient who went through a neck liposuction, and this is just to kind of get rid of the little double chin area that you can see on me right here.
Yeah, women say, I'm in the family photo and I hate myself. I hate that neck. I hate that poor definition, that oblique neck. So this is just liposuction of the neck. I use the Vaser that also helps tighten the skin. And so define the jawline better for her. So it really makes her face look a little bit younger.
That does look good.
Yeah.
How long is the recovery time for this one?
It takes, the initial recovery is about a week. I have them wear kind of a chin strap at home for another 2 weeks.
Just to keep everything tight?
At night, to kind of help the skin tighten. But they can go out in a few days, really. You know, there's no minimal bruising.
Fantastic. All right, so we're going to look at somebody who went...
And it can be done under local, so, yeah.
Oh, really? So you're in and out in a single day. All right, our next patient went through a facelift, upper and lower eye surgery, right?
Yeah.
And fat grafts, I don't know what that is, and a brow lift.
Okay. So this lady is 49. She obviously spent a lot of time in the outdoors and has a lot of skin damage, has thin skin and a lot of looseness as well. So if somebody like this comes in and I said, I want Botox, well, yeah, I can give you Botox, but it's not going to change anything, you know. So really she needs more invasive procedure. So she did have a facelift. Upper eyelids, lower eyelids done, and the brow lifted. We don't lift the brow too high. We just want to position it just above the brow
she looks
ridge.
great.
So,
that's nice.
so that's the, you know, take of the jowls. And then we did some fat in her perioral area, you know, to feel that out a little bit more than in her lips.
Perioral is where?
The folds, the nasolabial folds, the chin around
around
her lips. She needs a little bit more fat, and also in the cheeks a little bit, you know, to bring it out. She has a small face. She's a slender woman. You don't want to give her moon face, but you want to still keep her in
We're going to save our last before and after for our doc panel in a little bit, but part of what you've taught us is that some of the rejuvenation has to do with just replacing the volume that we lose with age. And so it's not always, you know, maybe what we think we want done isn't quite what we need, and so if we come to you, you can kind of figure out how to sculpt us. If you could just do something with my neck, that's what I'd really like to do. I'm like Nora Ephron. It's the neck that's bothering me.
Yes, that's common.
I've heard that is something that other people think too.
So.
If you'd like to schedule a consultation with Dr. Marosan, we posted his contact information and more about Bellevue plastic surgeons on our website, which is king5.com/new day. Now, a little bit later, a high-energy performance from pop diva Katie Z. But first, Wellness Wednesday continues with a lesson in massage to relieve pain and why that's so different than what you'd expect perhaps on a spa day. We'll be right back.